Guten Morgen. Wow, that was on a timer. I didn't even know it was going to start. So, this is a thrilling episode of my health update. Since my last video, I think a lot of things haven't really changed in terms of superficial things. My skin, still what it was. I kind of gave up on it because I'd been so diligent, and I can kind of get it to change a little bit when I change my game, but not much. It kind of just seems like maybe if my immune system wants it to be there, it's there, unless I'm gonna like bring out some big guns. I mean, I probably should stay at it. And I kind of do, but not topically. I stay at it with diet and lifestyle. But anyway, my UTIs have been fine. I do preventative maintenance with D-Manos and NAC and some antipathogen cycling and stuff. My colonoscopy went awesome. No trouble, no inflammation there. My rectum is still in good standing. And I guess the biggest thing here is my surgery update and my liver situation. So I had a surgical drama between all the surgeons, Victoria and Vancouver, and I got myself in a bit of a situation that seemed a lot more political than medical. But that's a story in and of itself, so I'm not going to go into that today. Long story short, I've moved my surgical care to Vancouver, and things are moving really fast. So things sped up because for whatever reasons, probably a few reasons. Now I did have to I got an ultrasound on my liver, but my liver specialist said that he really just doesn't trust the ultrasounds. I think in particular the techniques and techs at a local hospital here, they're not as advanced as down in Victoria. So I ended up getting scheduled for a venogram, and they were going to go basically sneak in through my transjugular and get the portal pressure. But they had a really hard time. It was supposed to be, a relatively quick procedure, but they had a really hard time getting through, and extremely difficult. And I found out after the fact they'd never seen anything like it ever. This interventional radiologist, which I found out interventional radiologists are not the same as radiologists, so they're two different categories. So these are more advanced doctors, very technical. They're quite cool actually, but not a young radiologist, interventional radiologist, and never seen anything like it. Tried to get another radiologist in, couldn't. Ended up on the phone with my liver specialist for quite a while I'm laying on the table, and they determined that I had a stenosis, so a narrowing. So in my liver, when the blood comes into the liver through the portal vein, there's I guess for you guys, how is this going to work? Right and left, and the middle, there's three kind of main vessels. And my left is good, but the other two are very narrowed. And I had been told that the sinusoids, the small blood vessels in this kind of fleshy part, had been impaired, and I was diagnosed with sinusoidal dilation, which was causing the non-cirrhotic portal hypertension. But they changed my diagnosis now, and they said that they think that all this impairment is actually like a byproduct of the narrowing of two of the three vessels, right? So the thing that didn't make sense about it, though, I was saying, if they put the shunt in last time, you would have thought they would have seen the narrowing just the same as they saw it this time. And if they put the shunt in and it was effective, then why is it now not effective because of the narrowing? So anyway, let's just say the shunt was here. Let's just say it's somewhere near the right atrium. I don't know exactly, because I was told I have to talk to the interventional radiologist to know exactly. The hepatologist didn't have all the details because they didn't do the work. Let's just say it was here though, okay? Basically the narrowing was closing off the ability for the blood to get to the shunt. So even though I think I naturally sort of self-medicate my symptoms and tend to like downplay the things I feel and just kind of um, make up for it. It had gone from, so when last time when I had it placed, I had gone from, it had originally been 26. I got it down to 19 in 15 months, a lot of natural stuff. And then they got it from 19 to 11. But when I went in, they thought it was 16, and then no, they said 17. So it's kind of complicated and technical as you see, but, and they admittedly said, we have no idea what's going on. We've never seen this. It's very bizarre. And we're scratching our heads. So I now have enlarged my medical team territory. I will have an interventional radiologist watching me. I think I'm a bit of an exhibit now. And so they got it though from 17. What he ended up doing was placing 2 stents somehow with the shunt to bolster it. And so, yeah, they got it to 8. They got the pressure to 8. And anything under 10 is considered like clinically acceptable. Normal is under 5. So that's really good, except that last time after they shunted it, it went up. In this last year, it went up from 11 to 17. So they're concerned, I think, about the long-term outcomes here. So what they were careful about was, for whatever reason, I think if they kind of stent and shunt too far where it hits the valve that goes to the heart, you become disqualified for a liver transplant because it puts the heart at risk. And so they were careful not to go over that. Now, I did ask because they had told me the shunt could move. So I'm guessing stents can also. And if it were to move up where it shouldn't be, I think that could be pretty problematic. But he actually didn't respond. So I need to talk to a radiologist about the whole situation. But in any event, for now, things look really good. I have a shunting stent situation in my liver that's helping the blood pass through to keep my pressure at a very reasonable rate. So it's a good little window of time to kind of deal with the rectum situation. So I have been booked for a surgery, and it's the 23rd, which is, today is a Tuesday, so it's a week from tomorrow in Vancouver. Now, it could be bumped at any point because of an emergency or, whatever, right? Don't count your chickens before they hatch. But the plan is to be cut open from, is this the sternum? All the way down, and kind of clean up any scar tissue if there is from last time. Find the ostomy end with the rectum end, put them together, and then take my abdominal wall, which, like, let's say this is my belly skin, and these layers should all be together, but they haven't been. So they're going to peel them apart and then pull them together and stitch them up, and like that. And I don't know for sure, but I found out if they use a mesh, they're going to use a dissolvable mesh, and they might use a technique with no mesh. So I'm not 100% sure which way they're going to go with that. I don't know specifically. I've never talked to the female doing my abdominal wall, but she came with really good review, and the gastro surgeon is like top in BC. So I ended up with, actually, who had been my first choice when I first found out I was going to need a reversal, but the wait time for him was so much longer, like 4 times as long as the other surgeons. So I just kind of wrote him off. But long story short, as God would have it, he's who I got. So anyway, I think the team looks good. My husband, Ryan, will be taking me over, and we have a crew on board for child support. And so that's the big thing. I guess I'm going to be asking for prayer. I don't think hemorrhaging is as huge of a concern as it could have been with the pressures at 8, providing that's all holding up well, what just happened on Friday inside my liver. And so now it's just the, risks of infection. Doing bowel surgery with an abdominal wall repair together are a little higher, and reanastomosis, reconnection, is more risky for people with IBD than, let's say, cancer or whatever. There's just an added risk factor, but risk, whatever. God's bigger than all things at all times, so that's gonna be what it is. And so there you have it. That's the big deal, and I'll keep you updated for the journey.